everyone. So all of us have too much going on in our life and in our mind, and we always say to talk it out in order to feel light and to feel better.
Jumping Mind is one of its kind mental health tech startup.
A safe place to connect with friends and talk about real life challenges.
To spread 1 billion smiles and create one happy world. That's what we aim for. We are Jumping Minds.
We are Jumping Minds.
So, download Jumping Minds app today and feel better instantly through personalized smart solutions.
Have you ever wondered what it takes to carry out last mile delivery? Logistics is something that we all rely on every day. While getting stuff from point A to B may seem simple, doing it a million times a year across the most difficult terrains of the country and in remote corners of India is about as complicated as it gets. With a fleet of more than 7,500 trucks in over 600 cities and a network of 33,038 PIN codes, Safe Express covers every square inch of India and delivers to the last mile and beyond. Keeping track of what is happening where requires us to capture that data at various levels. If we did that on a manual basis or on an unstable ERP, it would just not be possible ever. Digital transformation has played a key role in helping us stay ahead of the curve and is critical to our business operations.
With platform and cloud strategy being the core pillars of our IT roadmap, we strongly shaped a transformation vision around the fact that the upcoming era is going to be centered on platforms and not products. We are looking to move away from several administrative processes, bring transparency, placing more emphasis on agility in terms of faster technology solutions that will help our core business.
So we chose Oracle ERP Cloud, considering it to be the most stable platform on the market. It is good, in fact great, for managing any number of transactions and gives us our results quickly.
Oracle ERP Cloud is one of the most stable platforms in the market. It is good for managing any number of transactions, integrated with one of our latest innovations called SafeDrop, which is an in-house platform and mobile app to allow last mile delivery using handheld devices. This app was created using API integration with Payment Gateway and Oracle Fusion. It has helped us digitize
BHU, which is, one of the oldest and probably one of the most reputed universities in the country. A little bit about me: I was born and brought up in Kanpur, so from UP itself, and then I ran away during my JE days. So IIT Delhi was my first preference. I was fortunate enough to get that, and studied at IIT Delhi, then graduated. I was very confused. I think I followed what in the day everyone used to do, which is apply for masters and PhDs. Got a bunch, but I wasn't sure. So I was also fortunate to get a job in the Bay Area. So I worked in the Bay Area from 2001 till 2013 December-ish. Again, did a variety of different things, wrote operating systems. I don't know how many of you even know what operating systems are anymore, but I wrote operating systems for a living. And then went to run an online game. So Zynga, I worked at Zynga, which used to make games on the Facebook platform. I used to run this game called Farmville, which was one of the biggest games at the time, had around 20 million daily active users, which was huge. And I think I learned a ton of things about consumer internet at the time. 2014 is when I moved back and I joined Prashant and Sameer, who were very good friends at HealthCart, which is a nutrition startup. If any of you are into bodybuilding, they probably have heard of Muscle Blaze and HealthCart. So did that for around 8 months, 9 months or so. And then I was fortunate that Prashant offered me an opportunity to join him, as we 1mg existed before, actually HealthCart Plus existed before it became 1mg. And so, from there, 2015 is when the 1mg journey started. It was, of course, very, very small back then. Still, however, in the early days of the app ecosystem, HealthCart Plus was still huge. As you also know, you'd used it back then. And then since then, we've been on this mission to make healthcare accessible, affordable, and understandable. And we truly believe in that vision. I think it's become solidified over the past 7-8 years. And and happy to talk about anything you guys want to talk about.
Okay, so to that, I will ask you my first question. After being in 7 years in the industries, like you have slowly seen how the delivery of healthcare has evolved. So when you started versus drawing a contrast to now, what problems and what change do you see in the industry, especially related to the problems in delivering healthcare?
Yeah, no, that's a great question. I think that if I just talk about the broader Indian startup ecosystem, right? When I was giving this example to someone else the other day, when I had just moved back to India, I think there were maybe 10 reasonable scale startups in India, and HealthCart was one of them. And everything was, and I remember that we used to joke about how small the Indian ecosystem was, how subscale the businesses and the markets were. And you fast forward, I think 7-8 years. Today, 1mg does around 1.5 million transactions a month, and we still consider that small compared to what we used to do back in the day, which was 75 to 100 on a decent day. So I think if you generally just look at the overall ecosystem, I think it's become huge. And if you just focus on healthcare in general, back in the day, no one believed that healthcare, there were all these questions, right? Why would healthcare go online? What about trust? What about reliability? Why would you consult a doctor online? And why would you get tested at home? Medicines, who needs medicines online when you can call your neighborhood pharmacy guy and he will deliver? And in hindsight, I think all of our hypothesis as to affordability, accessibility of healthcare, and how internet is a better medium to deliver them has actually become true, right? And so in that perspective, I feel that today, and if we just fast forward, what 1mg has really solved is it has solved sort of like the Rails problem, right? Which is that before you build deeper healthcare services around, let's say, diabetes management and mental wellness and maybe AI in healthcare, you have to make sure that people can see their doctors, get their medicines, get tested on time, at home, in a reliable and trustworthy fashion, right? Because if the infrastructure, if the nuts and bolts don't exist, then you can't build a house on top of it, right? And what 1MG and so many like us have really done is that they built out the foundation of the healthcare ecosystem in the country, right? And today we are seeing so much innovation now starting to happen around therapy areas. People are building products that are specifically tailored towards, let's say, diabetics and cardiac. And what they're banking on, each one of these startups, is they are banking on the supply chain that 1MG set up, or let's say other companies like 1MG set up to make sure that people can get the services delivered to their home reliably, right? So to summarize, I think we built, 1MG's done a lot of the hard work in building and scaling up, the base infrastructure required to build the next generation of services. There's a ton of services that we are building, and there's a bunch of startups that are also building out services in the healthcare ecosystem.
Yes, so we see like people working on accessibility and reliability of the test. Like just a simple question around your early days, because obviously trust is a major factor in healthcare, and it certainly should be, because India is a country where people still have family doctors and trust like suggestions more than any other website or forum. So how tough it was acquiring people in early stage?
Yeah, that's again great question, and I think trust is a very, very complex complex piece, and here I feel that 1MG was fortunate, and it's probably useful to talk about, beneficial to talk about 1MG or Health Card Plus's story. So as I mentioned, Health Card Plus existed, before 1MG, and a lot of work was being done even before, let's say, I came on the scene. And there, the core hypothesis was as follows: if you and both Prashant and I, we've spent enough time in the West. If you look at the West, then the way medicines work in the West is that you have what is called an innovator molecule, which is the person who invented the molecule. They have patents and rights on that molecule, and they are the only ones that can market that product. But then once the patent expires, then anyone can do a generic molecule. And in the US, what happens, for instance, is that you have Walgreens and CVS's of the world that would do retail molecules. And it's very, very simple, because based on your insurance program, either you get paid for the innovator molecule or you got paid for the generic molecule, right? But when we moved back to India, when Prashant moved back to India, he found that it was very bizarre that India is basically a branded generic market, right? I don't know how many of you know, but you would have read this, that India is like the pharmaceutical manufacturing capital of the world. There's so many medicines that are sold the world over that are actually manufactured in factories in India. And what happens is that almost for every medicine sort that exists in our country, we have 80 to 100 brands. And the reason so many brands exist is because doctors write brands, and as a legal, not a loophole, but as a legal hindrance in the system, you can only dispense a brand name, right? So if a doctor writes, let's say, a particular brand A, then you cannot give a brand B, even though the brand B is the same or it's cheaper or manufactured by an equally reputable manufacturer, for instance, right? So we felt that this was like a great inequality in the system, right? That people were having to buy expensive medicines, even though cheaper medicines were available. And that's how Health Card Plus came about. So before Health Card Plus started to sell medicines, it was actually a Google style, very early Google style box, where you just had a search box. You could enter the name of any medicine, and you could search for it, and you could basically read all the information about it. And when I said that 1MG's mission is to make healthcare understandable, our first stated mission was that, hey, if a cheaper medicine exists, which is of equal quality, comes from an equally trustworthy manufacturer, etc., then people should be aware about it. They should be able to go back to their doctors and say, hey, can you write me something that can save me some money on my medicine bills, right? Now, this platform that we built, and this is how 1MG started, is we actually built the information platform before we built any transactions on top of it. This information platform is what got us users on the platform. And this is what built trust to begin with. In fact, it's so funny that in early days, we used to see all these messages floating around in people's social circles, because WhatsApp had also just started to come about, where they would say, hey, did you know that you could save medicines? And your doctors are writing, well, not their fault, but doctors are writing expensive medicines. You can save 80, 90%. And 1mg became, for lack of a better word, like a huge social movement where people would tell their friends and family about how to save medicines, or people in their walking groups, etc. And that's how we grew. Like 1mg didn't have any marketing money at that time. And in hindsight, I realized that that's how we got a lot of the trust. So it's really funny that when after that 1mg became an e-commerce platform with medicines and tests, most people said, oh, I know 1mg, I go to 1mg to read information about medicines, but I didn't know that you also sold medicines, right? And so they would come, they would read all the information, but they would miss the buy button, right? And so that's how we got our trust. That's how we acquired users. And even today, I don't know if you guys know, but 1mg is one of the top healthcare websites in the world. So if you go to SimilarWeb and you check for 1mg, we come in the top 20 healthcare websites in the world, the last time I checked at least. And a lot of that is built on the quality of content that we have built, and it's something that we keep doing almost like a PhD in and day out.
So I really remember my father searching like medicines for my grandparents, for them and himself, and even me when I'm ill sometimes. So yeah, that's how it's evolved. Like talking about the pharmacies, we still know that around 97% of pharmacies still sold offline. So there's always a very great space. So how you see 1mg acquiring that? There is a lot of space available.
Yeah, no, again, look, so the way we think about the way 1mg thinks about any problem, and I think that the way before you do anything new, you have to make sure that what you're doing, you're absolutely the best at, right? So it's very clear to us that, and it's clear in the market as well. If you look at most players, they're going omni-channel in a variety of different ways. If you look at Amazon in the US also, Amazon in the US has become omni-channel through its acquisition of Whole Foods, through its opening of, let's say, these stores which doesn't require any payment authentication, etc. Right? The cash register free stores. So it's absolutely true and definite that the future of retail is omni-channel, right? There's no one channel that's going to win, offline or online. Now, when it comes to how we are thinking about it, omni-channel is a clear priority for us, but today we don't know much about it, right? In the sense that we are an online first, we understand the online ecosystem, customer acquisition, cost, operations, efficiency, etc. really, really well when it comes to running online operations. So what we're doing today is we are doing very, very calculated pilots in almost all areas of businesses that we operate. We have some experience doing omni-channel. I don't know if how many of you are from the Delhi NCR area, but if you've heard of Medanta as a hospital, we used to run offline pharmacies in Medanta for many years. In Fortis, for instance, Fortis Gurgaon, Mohali, etc., we still run the offline pharmacies there. So we have some exposure to running offline pharmacies. But now we are actually doing pilots. So we have 5 offline stores in Gurgaon, and we basically have a full set of metrics and customer behavior that we want to measure and see how it goes. Even in offline stores, the way our strategy is today to do integrated healthcare. So our offline stores are being planned with not just medicines, but also diagnostics and consultations bundled in. So the consultations are online, diagnostics, you can walk in and get your blood sample drawn right then and there. So there are 5 stores that are happening. Many more stores will come up during the year as we go along. And then once we learn, we'll figure out what do we need to tweak before we scale this enterprise and figure out what we want to do here.
Going omni-channel will certainly put you in direct competition with big pharmacy chain like Apollo and all. It will be interesting seeing how it turns out.
Look, we are already in competition with them, right? Because Apollo has Apollo 24/7, which is doing online. So whichever way you cut it, we are in competition. So you have to compete.
like it will be head to head later on.
Yeah.
Okay. Like you talked about diagnostics and all. Like I recently heard this week the launch of new Tata super app, the Tata New. And how do you see 1mg playing in this Tata ecosystem, and what's its future will be?
Again, I can't comment on the future because I think that's something that I think the Tata New Group should comment on. But look, when we look at lifestyle, right? Then health and wellness is a very, very core component of lifestyle, right? Just like grocery is or e-commerce is, for instance, right? And what 1mg is going to do is 1mg is going to play a pivotal role in ensuring that whatever the group does in a digital fashion when it comes to health, we are going to power that very, very actively and in a front and center fashion. So when it comes to Tata New, 1mg is going to be the primary healthcare partner there, providing pharmacy, diagnostics, etc., and then launching additional services with other wellness brands, etc., on the platform as well.
Okay, just can you elaborate on your diagnostics plans? Because like I really read in the news that VCs are also more interested in and investing in diagnostics, preventive care these days. So what are your ideas about that and like your views on it?
Yeah, look, we started our diagnostics business in 2016. And again, if I go back, what we wanted to do, and this is a line that we still have, we've had from day one, probably in every investor or public or internal deck that we presented, is 1mg's mission, right? And our mission has been to build an integrated healthcare platform that makes healthcare understandable, accessible, affordable, right? And the key word here was integrated. Integrated means, see, if you look at India today, right? India is an under spent from a healthcare standpoint, right? India has one of the lowest healthcare spends in the world for the size of the economy we are. India is also underpenetrated when it comes to insurance, right? Even if you look at insurance penetration, most of that insurance penetration is for hospitalization, right? If you are sick and you need to get admitted, quite likely you may have insurance, meaning 30-40% maybe people have insurance. But when it comes to outpatient, which is your day-to-day care, going to a doctor, getting tested, seeing results, getting medicines, none of that is covered. And that leads to actually perverse behaviors in the ecosystem, right? What happens is because I strongly believe, and I believe it even more after spending many years at 1mg now, is that health and finance are very similar. Healthcare is a financial problem because if you can incentivize a user to save money in the future, you need to be healthy today. The problem is that you don't save money in the future unless someone underwrites that risk in some way, right? So that's a huge problem in terms of how this ecosystem plays out. Now, in building the integrated healthcare platform, diagnostics is actually a really, really important part of it. In fact, if you look at India also, in India, the preventative part of diagnostics, right, which is health packages, etc., annual health packages, 6-monthly health packages, they actually end up penetrated. And what happens is that people go to the doctor, they get acute, which is you have fever, a lot, but the preventive happens less. And one of the big reasons why preventive care is less in India is because it's expensive and cumbersome, right? You have to go to a doctor, stand in line. Typically for most people, it means loss of wages, loss of time, loss of work, etc. So with 1mg, our diagnostics platform actually enables you to get tested at home. It's very simple. You go online, you find a slot, you pick a package, you get tested. That's how we started. Someone comes to your home, someone who comes to your home is actually a qualified professional who comes and draws your blood sample. Now, when we actually started as a marketplace of labs. So we had NABL certified labs. NABL is an accreditation board that provides accreditation to laboratories. So we would work with Thyrocare, Lalpath Lab, etc. And all we would do is we would be a lead gen platform, right? Which is we would take the orders, but then eventually the order would get fulfilled by, let's say, the third party lab. But what we found was that, and this is true in India in general, that when you are dependent on a third party provider for service delivery, then your because we are still in the process of building out the whole infrastructure, right? We found that the quality of delivery, service quality was really poor when it came to delivery, right? So I'll give you some numbers there. If you were to book a test in those days on the 1mg platform, the probability that a phlebotomist, the guy who collects your blood sample, would come on time was around 65 to 70%, which means in 30-35% of the cases, the guy would never show up, right? And there's nothing you could do. Also, he or she would collect a sample, but then the sample would get bad because they were not being stored properly, etc. Again, we would have more than what we would have liked in terms of quality errors that would happen. So eventually we decided that any clinical healthcare service, quality is really important, and 1mg's trust was really important. So over time, what we've done is that today 1mg does 100% sample collection with its own fleet. We have a 95% on-time sample collection rate. We have a near zero rate of analytical errors. If they happen, they get diagnosed and resamples happen. In addition to that, even the backend, right? Because we wanted to make sure that users get reports very, very quickly, because diagnosis is really important. So we now run around 10 diagnostic labs. In fact, just last month, we opened a state-of-the-art diagnostic lab in Okhla, New Delhi. This lab can do 4,000 samples an hour. Which is one of the highest rate of samples, and it's a really, it's a really cool, fully automated robotic track. So you just put trays in, and there are all these fancy conveyor belts and robotic arms that basically pick the samples, put them in different machines, give you the reports, etc. And it's just fascinating, right? And that shows what's possible if you have scale, and if you can bring in state-of-the-art technology to how you're delivering healthcare, because it brings the cost down, it takes the quality up, right? And that's what we are continuing to do with diagnostics. Our goal is to get to 98% on or before time collection rates. We are probably going to open 10 more diagnostic labs in the country this year. And we're probably already one of the largest diagnostic providers in the country. And we want to continue to accelerate our growth.
Okay, I have 3-4 questions at once. First of all, I'll start by National Digital Health Mission, and as you stated, trust being a very difficult factor, and I guess government is trying to work in that space very well through the National Digital Health Mission, and listing all the doctors, pharmacies, and our pathology labs and all. So how do you see National Digital Health Mission helping Indian startup ecosystem, especially in the healthcare sector? And it's said to be equally revolutionary, like how UPI has been in the finance.
Yeah, and I think it can be. If you look at, again, if you go back and look at UPI, I think what it did was it basically said it doesn't matter where your bank account is. I'm going to give you a set of trustworthy mechanisms and APIs to move money back and forth, and then I'm going to enable a whole ecosystem on top of it, right? Now, if you just forget that for a second and come to healthcare, right? One of the biggest challenges in healthcare is that you don't know who's an authorized provider, meaning but it's not easy to know. So for instance, with doctors, there are MCI registration numbers, there are local MCI registration numbers, there's a national registry of doctors, etc. Right? And let's say if an e-consult startup wants to start by bringing doctors on board and providing consultations to patients, then it has to do a lot of KYC, know your customer kind of work. It has to get copies of degrees. It has to figure out what their certificates are. It has to go to MCI and register and sort of figure out their registration details, authenticity of them, etc. Right? And on top of that, this is just the KYC. And now once the doctor starts to, let's say, provide consultations, it has to build another set of intelligence to figure out whether the doctor is good, not good, etc. Even though maybe 5 other startups have worked with the same doctor before and have a lot of information, right? So if you think about NDHM, then just like 1mg is built, the nuts and bolts rails of medicine delivery. Like today, for instance, and we work with a lot of startups. If you want orders to get taken, you have to build orders through an API, and our order delivery rates are 99% plus efficiency, right? And we are very, very proud of that. Now, what NDHM will do or is trying to do is the same, that if a startup wants to, let's say, get 20 doctors, then the registry and verification of that doctors happens just like UPI. And what used to take months or years or weeks in terms of contract signing, finding, etc., becomes, a matter of hours. Same is true for, let's say, diagnostic labs. Same is true for pharmacies, for instance, right? The moment you do that, where you know that these are trustworthy, licensed healthcare providers, you can build so many layers on top of it, right? Because the base layer work is done. You can now build layers on top of it, which says, okay, I can give you reviews, let's say, for a doctor across all the e-consult platforms that he works with, right? And that can make it very easy for a doctor to be onboarded or offboarded by an e-consult platform. It creates a new set of problems as well, because if a doctor, let's say, has poor reviews on other e-consult platforms, he may not get onboarded at all. So with every new platform, new with the advantages, disadvantages also come. But in this case, I feel that what will happen is that the ecosystem will become verified, right? You will know who are the verified providers in healthcare. That's one. I think the second thing that will happen is that there will be data interoperability, right? And that's like the big dream, is doctors who are, let's say, doctors, pharmacies, diagnostic providers who are all generating data in their silos today, at some point maybe will start to interoperate and move data around aggregators, etc. So it could be hugely powerful, but like I said, with something so powerful coming in, we'll also have to figure out what are the ways in which maybe it creates perverse incentives, or how it needs to get regulated, etc., or for safe use.
I'm really hoping that in next 3 to 4 years we will be able to see very big ecosystems to this. What's your imagination on this? What type of ecosystem will exist with National Digital Health Mission in upcoming 3 years or maybe 5 years?
Yeah, no, look. So if you ask me, if I just was doing Blue Sky, and here I'm now talking as a 1mg Tata 1mg co-founder, etc. Look, the holy grail in healthcare is for everyone to go to doctor when they need it, not when they are really sick on the deathbed per se and need to be hospitalized in the ICU needing critical care, right? And that's really what healthcare ecosystems across the world have tried to do, is how do you get people to take care of their health progressively rather than reactively, right? And the biggest challenge I feel in progressive taking care of health is the fact that there is no payer in India, right? So if you look at any developed healthcare market, then there are typically 3 players in that market, right? One is the provider, right? The doctor, the pharmacy, the diagnostic lab. The second is the customer who actually gets all these services. And there's a third really important entity in the picture, which is the payer, right? The guy who's paying for these services, defining what can be paid for, at what rate, what are the safe. And this payer actually, in well-designed systems actually plays a really important role, because it can create incentives for both the provider and the customer. So I'll give you an example. I came across this really cool case in Europe, in Switzerland, I think, where they incentivized customers to go to doctors 4 times a year. And they said, hey, if you just went to a doctor 4 times a year, I will actually give you incentive on your insurance, right? And just this incentive, and which is why, again, one of the comments I made earlier was that healthcare and finance are very, very closely tied, because finance provides the incentives and healthcare is what basically, healthcare is the behavior change that you can drive. And what they were able to do was that just by providing these incentives so that a patient goes to a doctor, they were able to progressively create a program that brought down people's, diabetes and cardiovascular markers and made them healthier in general. Now, the problem in India is that most of our spend actually is out of pocket, right? Which means that the way to save, the financial incentive for us is to not go to a doctor, right? Because that's how you save all the money. And I think that one of the biggest things that Ayushman Bharat or NDHM can do is to actually create a large payer economy. Imagine if, for instance, going to a doctor was actually, government became one of the largest, let's say, payers, and going to a doctor was, let's say, free for you, right? Or it cost you maybe 5, 10, 20 rupees instead of the 500 rupees that it costs, right? And you could select a bunch of doctors. And the way the government would make money is it would basically be able to reduce its inpatient insurance spends, which is what is done in rest of the world, is that you pay for this outpatient insurance by actually demonstrating that you're able to delay hospitalization by 2, 3, 4 years, right? And that's how you fund the whole exercise. So if you ask me, my real hope and vision is with NDHM is that it actually creates interoperable data, which generates where India becomes maybe the first country in the world to have large-scale longitudinal data that it puts in place an infrastructure through which large-scale payers can find preventive care for patients. And it also creates an ecosystem through which getting services becomes very, very easy. Now, whether or not that happens, we'll see. But I have high hopes from NDHM.
No, we certainly needs more preventive care, especially for the chronic diseases, and monitoring has really been a challenge. And especially talking about monitoring, the rural sector, like obviously according to WHO benchmark, we have around 166K shortage of doctor, especially in the rural area. So how do you see healthcare startup playing role in this rural area?
Yeah. No, that's a tough problem, and the biggest challenge with the lack of doctors in, let's say, not just rural, right? In fact, across the board, what maybe urban centers don't have the problem of doctors, but they have the problem of specialists, right? Where compared to, let's say, an advanced country where an endocrinologist would be the only guy who would talk to diabetes patients, in India, basically physicians end up becoming, a part endocrinologist, right? Because we have maybe only a few hundred, I don't know the numbers, but only a few endocrinologists in the country, or the number of them is much lower than what we need today. The other part of the problem is that India is not creating enough doctors. It's a 5-year program. We just don't have enough number of schools, colleges that are churning out doctors. And even if you do, a lot of medical practitioners, or I don't know what the word is, but medical science is about, experience and learning and figuring out, what clinical correlation, etc. is, right? So I think there are multiple ways in which that problem can be solved, right? One is that we have to recognize that majority patients who come to doctors actually have fairly simple symptoms. And in fact, if you go to a doctor's clinic and you see what a doctor does, most of the times the doctor takes a variety of different factors into account, which is, what's going on from a seasonal perspective, my past 5 patients today have had similar symptoms, right, etc., etc. So it takes a lot of data. A doctor is like almost like an AI engine, human AI engine, right? So he takes a lot of these factors into account and then provides a diagnosis. In fact, many years back, 1mg published a study where what we took was we basically built a similar system. It was published in a really high quality journal. And what it did was it demonstrated that our AI engine for a certain set of conditions were actually more accurate than a panel of doctors, right? So if the same patient went to our AI versus the doctor, we were able to predict the right diagnosis better than the doctor panel by around 2 to 3 percentage points, which is huge in medical science, right? So I think the first and foremost is this recognition that there's a large chunk of conditions, right, which don't really require qualified professionals, but don't require a full-fledged doctor, and technology can play a huge role there in actually standardizing collection of data, collection of symptoms, diagnosis, etc. I don't know how many of you have heard, but there's this really cool tablet called the Swasth Slate. And I think it's this really low cost tablet which can do 20, 30 tests at the point of care, right? So one set of interventions that can happen is to say that, hey, for the most of the day-to-day communicable diseases stuff, actually technology is good enough, right? And the more you can enable a doctor with the right point of care device, the right data collection, the right, let's say, AI, etc., which assists a doctor, doesn't replace the doctor, but assists the doctor in making quicker decisions, faster decisions, better quality decisions. I think that's one big chunk of improvement that can happen. I think the second big chunk where I think NDHM, telemedicine, etc., are really important is that the doctor ecosystem is not efficiently distributed, in the sense that there are some doctors who have more demand that they know what to do with, right? And there are some doctors who, for whatever reason, their practices are not going really well because, it takes time to set up a practice, get the word out, etc. Technology, again, can be a great layer because it can bring efficiencies across the network. It can say that, hey, and this is again where NDHM can be very useful because it can now distribute demand much more evenly. So I think across the board, technology has a really critical role to play, whether it is in clinical decision science systems. We have a lot of, I don't know how many of you have heard of ASHA workers, but there are these semi-skilled workers, ASHA workers, who do a lot of healthcare, paramedical stuff in rural settings. Technology can play a critical role there. CDSS, remote monitoring can be really important. They can go to a patient's house, collect all the symptoms, connect with the doctor offline, so across the board, I think telemedicine, technology, AI, clinical decision support systems, point of care devices, they're all great areas to reduce the gap in doctor availability. The big problem is who's going to pay for it.
Now I understand. Obviously, I also feel that even Anganwadis are also very great place to penetrate in rural areas, small places. So,
Yep.
Just we need better government collaborations to it. That's great. Now again, I really agree with your point. Obviously, data can there is a large scope of analytics in this, improving the efficiency and helping us reduce the demand of manpower through data. So again, the new trend in data are Web3 and blockchain, improving trust. So how do you see Web3 and blockchain in healthcare?
First of all, I'll be honest. I'm by no means a blockchain. I understand the technology. I understand how it works, what's behind it, what's the core principle. And we've been involved in a few projects where we've tried to, let's say, for instance, there have been projects around supply chain, improving supply chain trust through blockchain, etc. My view today, and it may be incorrect, but my view today is that blockchain, etc., more than trust, they provide real, actually trustless systems of data aggregation, if you will, for lack of a better word, right? So it doesn't necessarily provide trust, but it provides a trustless system to work in a trustworthy fashion, right? The challenge in healthcare is not that trust is, the challenge in healthcare, at least the way I see today, is not that trust is controlled by few, let's say in the financial world, right? The big reason why blockchain or Bitcoin came out is because a lot of the financial world, the rest with a few really large banks or really large institutions, right? The problem in healthcare, in my view, is the fact that there is no trust, right? And the lack of trust exists because the systems of trust don't exist. And let me give you an example. If you go buy any product, any FMCG, OTC product, right? When you go buy shampoo, etc., you would see a barcode on the back. If you buy books, you will see a barcode on the back. Right? On medicines, there are no barcodes. They are not mandated. Medicines are not mandatorily required to have barcodes. And as an industry, we have resisted the government's push to actually mandate barcodes on medicines for the longest point in time, right? Now, sure, I can improve supply chain trust in the supply chain by doing blockchain work. But I can also improve supply chain trustworthiness by just putting a freaking barcode when the medicine is being manufactured, right? And guess what? What is easier? Putting a barcode. What is also more environmentally friendly is putting a freaking barcode, right? So I think that look, there are real benefits to blockchain, even in healthcare, right? In fact, many years ago, I read this paper published by MIT about using blockchain, and the way they were using blockchain was that they wanted to create like a trustless entity wherein multiple providers can share their data. There was no one owner of data. The data was actually owned by individual entities which were pushing in the data, but no one wanted, let's say, one hospital to own the system, right? So they eventually ended up agreeing to put all the data in a blockchain-centric way so that everyone would have equal rights and they would have complete rights to their data, right? So it makes sense in settings like that. But when it comes to, I think, supply chain and data, I think our problems are much more fundamental today and can be solved than actually needing for us to get to blockchain and Web3. That's my view.
That's really interesting because simple problem requires simple solution. You don't need complicated ones. I can not help but notice like you have a lot of books over here at your back in the background. Just a fun question: how your typical day looks like over here?
Now these books are just to make me look smart. Otherwise, I just correct them. No. What does my typical day look like? A lot of my time increasingly is spent on just with. So two large pieces of activity. One large piece of activity is just thinking about where do we want to be in 6, 9, 12 months, 2 years, 5 years time. We are very fortunate that 1MG has gotten to a scale, and we have a really good set of leaders and a great team that actually takes care of the day-to-day, near-term, mid-term execution really well. Really smart guys, very, very committed to the healthcare mission and also to 1MG. So there, I don't have to spend a lot of time, except there are quarterly reviews, etc., that happen. So two big portions of the day again. One part of it is just strategic, where we, Prashant, Tanmay, who's our Chief Operating Officer, and me spending more and more time thinking about, hey, how's the market evolving? What do we need to do to defend ourselves? What new businesses can we get in? What's not going so well? How do we staff, etc. So very, very strategic, and increasingly, 6 months, 12 months, 24 months down the line. And the second part of the day is much more review. And in the review also, part of it is just business review, and the other part is just organizational review. How do we build a high quality organization? How do we measure, how do we define what matters to us as a company, as a people organization? How do we enshrine those values? How do we reward them? How do we measure them? So that's in a nutshell what my day looks like. And then other than that, kids and some amount of running. I'm trying to run, so some amount of running, 3, maybe 4 days a week. And then if there's time, then some reading. That's about it.
Okay, that was really great. I heard you about searching, having strategic planning. So obviously you always interact with new startups in healthcare. So any interesting new startup which 1MG is looking towards, or anything you can share about?
No, I can't talk about, we keep looking at startups all the time, but I can tell you in general, startups that we are really, or areas that we are really excited about. As I mentioned, therapy areas are really interesting. So startups that are working in, let's say, diabetes, thyroid, female health, pregnancy, right? Anyone who's focused on a cohort of healthcare consumers, right? Cardiac patients, for instance, and improves the quality of life for them, right? So for instance, for cardiac patients, anyone who's doing point of care devices, measuring abnormalities in your heart rates, et cetera, providing better quality care, EKG at home, giving you coaching, diet planning, exercising, etc., etc. Right? So those are interesting areas. One vertical that we are very excited about is and what we call like therapy-based care. So 1mg is like a broad platform of health, and then therapy is a vertical. That's one very interesting thing. I think the second thing that's very interesting is benefits and payer models. As I said, healthcare is a financial problem. So as more payers come in, they will be able to direct the behavior of both the providers and the consumers. So all new payer ecosystems are very, very interesting. Recently, there's a bunch of startups that have come about in the insurance segment, which are bringing in not just insurance, but bundling them with benefits. So you buy an insurance plan and you get, let's say, once a year annual health check, you get free doctor visits, etc., etc. These are all great, great sort of interventions in the healthcare ecosystem, and we are very excited about them. Diagnostics is very interesting. Again, we think the future of diagnostics is at home, point of care, faster tests, better quality, consumer grade devices. In fact, we know so many startups that are replacing the large equipment that you see in the lab, which consumer grade, smartphone cameras, etc. Bring in AI to actually do high quality analytics and stuff. But that's another very, very interesting area that we keep interacting with startups about. So overall, look, there's a ton of stuff happening in healthcare, from diagnostics to care. And then, of course, how can I forget, WhatsApp? WhatsApp's providing new ways to connect with patients for healthcare as well. So there's a bunch of startups that are using WhatsApp for healthcare delivery. So that's also a very interesting area for us.
Like one of this, while you were speaking about more chronic diseases, I cannot help but remember the femtech space. It's also being. So what's your opinion? Because obviously all the research and even there are not sufficient data for female health and health monitoring, and it has been ignored for a very long time. And so how do you see any recent great startups, or what's your opinion? How will this space evolve?
Yeah, there's a bunch that are doing, in the PCOS, PCOD space, which affect women quite a bit, has long-term effects on their health. There's a bunch of new startups in maybe not health. It's in femtech, around, periods and, hygiene and products and pain relief, education, tracking. There's a bunch in fertility space as well. Across the board, look, you're absolutely right. I think, I don't want to sound gender classes, but big part, almost 50% of the human population and their needs have long been ignored. I'm glad to see we actually work with a few, female health, focused on female health tech startups very, very closely. Very excited about them. I just hope more and more such startups come about. But primarily today they operate in fertility, PCOS, PCOD spaces, etc. And I'm sure there'll be more.
All right. So certainly, sir, it was a pleasure. Actually, we are arriving at the end of the session, and it has been a really pleasure talking to you. And I really got very great insights about your view on healthcare sector. Now I generally feel that entrepreneurs have a very different perspective about the sector, and it was very great talking to you. And thank you, sir, for such an amazing session. It was very fun, interactive, and I got a lot of learnings from you, because personally I am interested in healthcare sector, and I'm actually also working on a femtech startup. So personally, I might connect with you.
Oh, right.
Yeah, it's actually on a femtech startup that's based on PCOS monitoring.
No, look, I just wanted to put it out here that, hey, if look, 1mg, we interact with a lot of startups. We have struggled as entrepreneurs, so we are very, very keen and happy to help and always ready to make time. Between both Prashant and I and Tanmay, we are often very willing to connect folks with our teams as well to understand and to help out. So if any of you want to connect in health tech or in general entrepreneurship space, absolutely happy to connect, very, very approachable, so you can reach out. And I would also put a plug in, if any of you are interested in working at 1mg, please do reach out. And we're always looking for smart folks to come take the healthcare mission forward. Right?
Thank you, sir, for such an intriguing.
Thank you so much. Thank you for having me. Bye. All the best. Thank you.
Thank you, sir.